So recently a student asked, what's the difference between pericarditis and ACS? Now, ACS is kind of an umbrella term that talks about the heart not receiving enough oxygenated blood flow and it becomes ischemic. And over time, that heart can become injured, which we know as ST segment elevation, and it can become infarcted or have necrotic or dead tissue. Now, the term pericarditis is inflammation of the pericardial sac that surrounds the heart, and typically this is seen with an infection. Now, for those of you who are trying to answer these type of test questions, whenever I'm considering ACS, I would like to see a 12 lead, but if the test question tells me that it's a gradual onset of pain and the pain's not getting any better when the person rests, yeah, that's typically a bad sign of acute coronary syndrome. So now imagine if you're taking a test and it tells you that the patient recently had surgery, the patient's tachycardic, they have a fever, and now they have chest pain. Well, obviously this is more pointing towards a pericarditis patient. Another thing that they're going to tell you on exams is that the pain either goes away or it gets better when the patient leans forward. Classic sign of pericarditis. Another thing we need to talk about are the 12-lead ECGs. Take a look at what pericarditis looks like. We note that there's not only a lot of ST segment elevation, but we also note the concaved appearances. Yep, take a look at this. Typically seen in pericarditis. Now with ACS, let's take a look at these ECGs. We note more of a convex appearance, not concave. Take a look at this one here. Now, convex ST segment elevation with narrowed QRS complexes is something that's telling me that this is ACS. Now, one thing to talk about with treatment. When talking about ACS, we all know that we give oxygen if the patient is hypoxic. We can go ahead and give our aspirin up to 324 milligrams and nitroglycerin. Still follow your protocol, but in National Registry standards, we're still only given the 3 total doses. Beyond that, if the patient is still in pain, we can consider analgesics, such as fentanyl. Now, but for pericarditis, we're still giving aspirin. We can withhold the nitroglycerin. Don't forget, attempt to lean that patient forward, and that should assist with pain management. If not, we could also give analgesics. But ultimately, this patient may require antibiotics for the infection. Hey, hope this helps.